Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. We're halfway through the BC election campaign and everyone has been totally normal. But what if a candidate said something on tape that people find offensive? What should that candidate do in that totally hypothetical situation? A crisis communications expert will walk us through it. Plus, the BC NDP announced a plan to make home ownership more accessible for middle-class families, but will it actually make housing more affordable? We'll dig into it, but first, let's talk about the closures of emergency rooms across the province as we continue our candidate series with someone who is no longer a candidate. She was a star BC United candidate for Surrey Cloverdale, but after BC United suspended their campaign, she's still focused on improving healthcare delivery in this province. An obstetrician-gynecologist at Surrey Memorial Hospital, she is Dr. Claudine Storness-Bliss. Doctor, thanks so much for being here tonight.
Thank you for having me.
So, with all these emergency room closures throughout the province, I've always wondered, what happens if in your community, your emergency room is shut down, it's closed for the weekend, and you break your leg or you have a heart attack? What are you supposed to do?
It's dependent on the nature of the emergency. So there are minor emergencies where you need to see a doctor soon, but maybe not immediately. So we're talking things like minor respiratory distress or symptoms of infection or a minor skin infection, for example. That can be delayed. So you could go see your family doctor the next day if you're lucky enough to have one. Walk-in clinics or urgent care centers. And you can also go to the nearest emergency room, and hopefully that one is open.
For some people, that might be like 40 minutes, an hour away,
correct,
right?
Correct.
Yeah, okay.
And then there are major emergencies, like a suspected heart attack or severe respiratory failure or a major trauma. Thankfully, those are usually handled by the ambulance services.
Okay.
And they know which emergency room is open or not and where to take you. The problem is where you fall in the middle, where you broke your leg, like you said, or, the respiratory symptoms are moderate. They're not minor, but you're not in respiratory failure, for example. And this is the gray zone of, I need a doctor now, but is not acutely life-threatening. And the problem with that is that it can become acutely life-threatening.
Right, it'll get worse, right?
Yeah. En route to your nearest emergency room, which, by the way, is what you should do no matter what.
Okay.
But it can also become acutely more severe while you're waiting to see a physician in the emergency room.
Right, because wait times are also quite long. Yeah.
So if multiple emergency rooms close, the nearest emergency room will typically be busier.
Sure.
And typically those patients in the middle are the patients that are affected the most by wait times. Because obviously if somebody is acutely dying, we take care of them right away. And by we, I mean physicians. I'm clearly not an emergency room doctor. And the minor illnesses will always wait a long time because of the nature of triaging of patients.
Right.
And so it's those patients that we really worry about. I always give the example of, say you live really close to an emergency room and your child is having an allergic reaction to, say, a bee sting, or it doesn't matter to what. You know that it's faster for you to take your child to that emergency room than to call 911, for example. Of
course, yeah.
So you drive your child there, but now the emergency room is closed. And now it's been, a significant amount of time. That can very quickly disintegrate into something more severe of a reaction. And this is where the danger falls.
Now, I think long-term, we all understand that we have to open up more hospitals, more urgent care centers, and the BC NDP touts that they've approved or are currently building 30 of these hospital projects. We also need to recruit more doctors and nurses. But can anything be done in the short term to help alleviate this emergency room crisis?
There is, and I think the right question to ask is, why are we in an emergency room crisis?
Okay, so let me rephrase. Why are we in an emergency room crisis?
And I think it's because, I know, the closures are driven by lack of physicians, right? So yes, we have a shortage of all medical experts. But definitely we have a shortage of physicians, and that's where if there's no physician to run the emergency room, you have to close it. So why are these physicians leaving? Why are they going somewhere else? Why are they retiring early? Why are they, in many cases, changing careers entirely?
Please tell me.
It's a very complex answer, but it falls to culture at work. It falls to lack of resources. So for example, being able to get a CT scan on a patient that's acutely ill, it becomes quite frustrating, but it's also dangerous, which then leads to moral injury. And yes, some of it is compensation. So then how do we fix that? And yes, we have to focus on recruiting more physicians. And the process of licensing across the country, but what I know in British Columbia, is handled by the College of Physicians and Surgeons of BC. And there's a lot of red tape there in being able to get licensed.
Oh, interesting.
And so this is why you have people who are physicians that from other countries who are now working as your, physiotherapist or your Uber driver or, other.
So we have talent here that could easily
here.
staff hospitals or family doctor offices, but they're being delayed.
Yes. And I don't think easily is quite correct, but that could definitely alleviate some of the pressures we're seeing. And I'm not suggesting that any physician from anywhere in the world should be able to practice here, but we should be able to recognize equivalency of training fairly quickly. We're not doing that, and that could be done, pretty quick.
Yeah.
And but I think that's recruitment. But then what about retention?
Yeah.
And the key really is to sit down with frontline workers and say, why? What's the problem? How can we help you? And part of that I know is the disparity of funding. So Vancouver Coastal Health doesn't have this problem. Why? Because the way the funding is in British Columbia for healthcare is it follows programs, not population. So while Fraser Health serves a bigger population, historically, Vancouver Coastal gets more funding because of their programs.
Interesting.
Yes.
Okay.
So then they have the ability to have dedicated imaging for their emergency rooms and better contracts for their physicians and right? This is how funding works.
Yeah.
And that can be also addressed really quickly. How about it's easy to come up with a formula of you pay by population and by services provided, and boom, here's your funding.
Yeah.
So there's ways to go about this that can be done really quickly, but it requires the willingness to sit down with the affected populations, be it nurses, technicians, physicians, and say, what's the problem? How can we make this better? As opposed to trying to come up with our own ideas on how to fix it.
Yeah, that makes so much sense. Doctor, what a pleasure to chat with you tonight. I'm sorry that you're no longer on the ballot, but I do appreciate your advocacy in our community and in our province. So thank you so much.
Thank you so much for having me.
Folks, that was Dr. Claudine Storness-Bliss of Surrey Memorial Hospital. Now, after some business, Premier David Eby announced a plan to help first-time home buyers get into the housing market with a lower down payment and lower mortgage payments. But will it actually make housing more affordable? We'll talk about it up next.